Symptoms, Remedies, and How to Manage Influenza. Your complete guide 1. What is influenza and why it matters? Influenza, or flu, is a contagious respiratory infection caused by influenza viruses that affect millions each year worldwide. Unlike the common cold, the flu can cause more severe illness and lead to dangerous complications, especially in vulnerable groups such as children, elderly people, pregnant women, and those with chronic health conditions. Understanding the nature of influenza, how it spreads, and its potential impact on health is essential for prevention and effective management. This knowledge empowers you to recognize symptoms early and take action to protect yourself and those around you. Staying informed about flu helps reduce panic and misinformation, encouraging healthier behaviors and better community responses during flu season. 2. Recognizing the warning signs of the flu. Flu symptoms often come on suddenly and can be intense. Key signs include a high fever, chills, muscle pain, exhaustion, headache, sore throat, dry cough, and nasal congestion. Children may also experience vomiting or diarrhea. These symptoms are typically more severe than those of a cold and can severely affect daily functioning. Fatigue from the flu may persist for weeks after other symptoms resolve. Early recognition allows you to rest, avoid spreading the virus, and seek medical care if necessary, especially if you belong to a high-risk group. Knowing how to differentiate flu from less severe illnesses improves timely treatment and prevents complications. 3. How influenza spreads and practical ways to protect yourself. Influenza spreads through droplets released when an infected person sneezes, coughs, or talks, as well as by touching contaminated surfaces and then touching the face. The virus is highly contagious, which is why flu outbreaks can rapidly spread in communities. Preventative measures include frequent hand washing with soap, using hand sanitizers, avoiding close contact with sick people, and covering coughs or sneezes with tissues or your elbow. Keeping commonly touched surfaces clean and well-ventilated spaces helps reduce transmission. The annual flu vaccine remains the most powerful tool to prevent infection and reduce severity if you do get sick. Educating those around you on hygiene practices is equally important in breaking the chain of infection. 4. When flu symptoms require medical attention. Most people recover from the flu with rest and self-care, but some cases warrant professional medical evaluation. Immediate care should be sought if symptoms worsen or include difficulty breathing, chest pain, persistent high fever, severe weakness, confusion, or dehydration. Young children, elderly adults, pregnant women, and people with underlying health conditions are especially vulnerable to flu complications. Early antiviral treatment within 48 hours of symptom onset can reduce the duration and severity of illness. Timely consultation helps differentiate flu from other respiratory illnesses and ensures appropriate care. Ignoring warning signs can lead to serious outcomes such as pneumonia or hospitalization. 5. Over-the-counter options for symptom relief. For mild to moderate flu symptoms, over-the-counter OTC medicines can provide effective relief. Pain relievers like acetaminophen or ibuprofen reduce fever, body aches, and headaches. Decongestants and saline nasal sprays alleviate nasal congestion. Cough suppressants and throat lozenges help soothe persistent coughing and sore throats. Alongside medication, staying well hydrated with water, herbal teas, and broths supports recovery. Using a humidifier can ease breathing difficulties and reduce throat irritation. These remedies ease discomfort but do not eliminate the virus, so adequate rest and symptom monitoring remain crucial. Always follow dosage instructions and consult a pharmacist or doctor if unsure. 6. Home remedies to support healing and comfort. Many natural approaches can complement medical treatments to ease flu symptoms and boost your body's healing ability. Honey mixed in warm water or tea soothes irritated throats and reduces coughing. Gargling salt water decreases throat inflammation and fights bacteria. Nutrient-dense foods like fruits, vegetables, and nourishing broths provide essential vitamins and minerals that strengthen immune response. Herbal remedies such as elderberry, echinacea, and ginger are believed to support recovery, though scientific evidence varies. Gentle exercise and adequate sleep promote circulation and tissue repair. Always discuss supplements with your healthcare provider to avoid interactions, especially if you have allergies or take medications. 7. The critical role of flu hydration in nutrition. Flu often leads to fever and sweating, which increase fluid loss and risk of dehydration. Maintaining adequate hydration with water, electrolyte solutions, and clear broths helps keep mucus thin and supports immune function. Avoid drinks that may dehydrate, such as caffeinated or sugary beverages. Nutrition is equally important. Even when appetite decreases, consuming small, frequent meals rich in immune-supporting nutrients like vitamin C, D, zinc, and protein accelerates recovery. Foods such as citrus fruits, leafy greens, nuts, and lean meats provide vital support to the immune system and energy needs during illness. Good nutrition also helps rebuild damaged tissues and maintain strength throughout the recovery process. 8. Rest and sleep, essential elements for flu recovery. Quality rest and sleep play a vital role in overcoming influenza. Sleep enhances the immune system by stimulating infection-fighting cells and antibodies. During illness, the body requires more downtime to repair damaged tissues and replenish energy. Ignoring fatigue and pushing through can prolong illness and increase complication risk. Aim for 7 to 9 hours of uninterrupted sleep nightly and allow daytime naps if necessary. Creating a quiet, comfortable sleeping environment free from distractions improves sleep quality, promotes healing, and lifts mood during recovery. Minimizing screen time and stress before bedtime also helps optimize restorative sleep. 9. Preventing flu transmission. While caring for others, caring for someone with the flu or dealing with it yourself requires precautions to prevent spreading the virus. Frequent hand washing, wearing masks during close contact, and disinfecting surfaces like doorknobs, phones, and countertops reduce transmission risk. Avoid sharing personal items such as towels, dishes, or utensils. Encouraging rest, hydration, and medication adherence aids the patient's recovery. Caregivers should monitor symptoms carefully and seek medical advice if worsening occurs. Emotional support and patience during recovery foster well-being and help ease the strain of illness on families. Implementing these measures helps protect vulnerable household members. 10. Long-term strategies to reduce flu risk and protect your health. Beyond managing symptoms, adopting long-term strategies is key to minimizing flu risk and severity. Annual flu vaccination is highly recommended, as it helps build immunity against prevalent strains and protects vulnerable populations. Maintaining a healthy lifestyle with balanced nutrition, regular exercise, stress management, and sufficient sleep strengthens your immune defenses year-round. Staying informed about flu activity in your area, practicing good hygiene, and seeking timely medical advice promote both personal and community health. Preventing flu protects you and contributes to reducing its global impact. Community efforts like vaccination campaigns and education play a crucial role in public health. If you found this guide helpful, please hit like and subscribe for more expert health advice and wellness tips. Share your experiences or questions in the comments below. Together, we can stay informed and healthy.